Good afternoon. I'm Steve Wright, and I'm honored to moderate this diverse panel of experts for the session titled Creating Inclusive Spaces Toward Accessible Cities. I'm a Universal Design keynote speaker, planner, in a previous life, a Pulitzer-nominated award-winning storyteller and writer, and I'm the Design Inclusion Advisor to Identity Public Relations. With me today, we have Prashanth Venkataram, Anna Zivarts, and I think joining us shortly is Eman Rimawi-Doster. So with no further ado, I will just say that Prashanth is a postdoctoral researcher at University of California, Davis, where he conducts research at the intersection of transportation and disability in the US. Anna is Director of Disability Mobility Initiative at Disability Rights Washington. And now just joining us, Eman is Executive Director of Diversity Includes Disability Organization. So, Doctor, we'll turn it over to you, sir, to give your presentation.
Thank you, Steve, for that lovely introduction, and thank you to all of the folks at Transportation Alternatives for organizing this conference and this session in particular. Shall I? Yeah, I think I'll just go ahead and start sharing my screen and then share my slides. So I just have a few slides to quickly illustrate some of the things that I've been working on and how this sort of broadly thematically relates to the goals and ideals of Vision Zero. So my research is at the intersection of transportation and disability. So this has involved conducting focus groups and surveys of the travel behavior of people with disabilities, as well as people without disabilities. Showing, for instance, that people with disabilities disproportionately don't drive compared to people without disabilities. But it's worth remembering that many people with disabilities still do drive. It's also involved interviews of people who professionally work with people who have experienced road collisions. Here, the connection to Vision Zero should be a little clearer. And one of the things that we found is that, especially in California, which is where I work and where most of my work has been focused, car-oriented land use patterns and the need for individuals to make a living often force people who have experienced road collisions to return to unsafe travel behaviors or to conditions for travel that are unsafe to them, although they still do have the agency to make certain changes to their travel that they can to try to make that travel safer, for instance, by taking different routes, traveling at different times of day, maybe cutting some trips that they used to make, and so on. And my work has also involved consideration of regulations of ride-hailing and autonomous mobility services as they are relevant to people with disabilities, with the intent of ensuring that people with different disabilities aren't excluded from these services anywhere. So one of the overarching questions of this session, and I'm sure it's one that we'll get to, especially after all of us panelists have presented and we get to the Q&A part, is how do we make sure that the Vision Zero movement, can more meaningfully engage with people with disabilities and not exclude them? And so the examples that I'm giving here are mostly from my own professional experiences. And so some lessons for organizations that are conducting their own research projects or planning projects. Make sure to reach out to CBOs, that is community-based organizations that represent people with disabilities, pay them as private consultants at comparable rates, consciously include study participants with disabilities and compensate them too fairly and in a timely way, and just stay engaged with all of them longer term. policy changes, of course, take a long time to happen, but that doesn't excuse, just dropping the ball with people who have contributed to the development of certain studies or to certain planning efforts as well. And likewise to organizations who are putting out requests for proposals, make sure that the people who are conducting projects that involve research or planning or implementation or things like that, make sure that the request for proposal have enough funding for researchers or contractors to meaningfully engage with CBOs representing people with disabilities, as well as with ordinary people with disabilities themselves who directly contribute to these kinds of projects. These are things that I, as an individual postdoctoral researcher in a university setting, have been able to do even with limited budgets. So I hope that this will be encouraging for anyone else at other organizations to take note of and do themselves. And there's one other point that I wanted to make based on some of the actual results from the projects that I've been working on, and that is that people may be unwilling to give up driving even in dangerous conditions or circumstances, again, due to a combination of economic need and the way that car-oriented land use systematically pushes for more car use almost by definition. There is some level of individual agency on this, but we need to make sure that the bulk of our efforts are focused on changes to these systems of car-oriented land use and transportation, as well as the sparsity in practice of systematic ways to make sure that people who may not be safe drivers can, in fact, safely stop driving and have alternatives to get around instead of just feeling stuck economically or socially. And lastly, I want to point out some, complications that I've seen when considering the kinds of interventions that are that commonly come with Vision Zero efforts and their intersection with people with disabilities. For instance, bike lanes often run alongside separated bike lanes often run alongside sidewalks and right next to road crosswalks or bus lanes. And if there isn't sufficient space and safe crossings given, this could negatively impact people with physical vision or cognitive disabilities. Likewise, there have been debates or disputes about in some circles of people with disabilities about whether sidewalks should be raised by a curb at all, because many people with disabilities find that the curb provides safety, but some people who use wheelchairs find that having a raised sidewalk can make things more difficult when crossing the street due to the difficulty of going down a ramp across the crosswalk and then up another curb ramp to get back on the sidewalk. This suggests the need for more raised crosswalks, and that's an area where we can resolve this apparent tension. A more difficult issue might be the issue of roundabouts, which can improve safety overall, but which have proven difficult for many people with vision impairments. And it's worth noting that new PROAG regulations and guidelines address the issue of safety for people with vision disabilities at multi-lane roundabouts, but admit that there's still a lot more work to be done even in single-lane roundabouts. And finally, one of the solutions that comes along with Vision Zero is the idea of converting certain areas into car-free areas, but it's worth remembering too that there may be some people who need personal care or who have identities or behaviors that make them vulnerable to interpersonal violence. This doesn't mean that car-free areas should never be used, but it does also mean that if these kinds of complaints do come up, they need to be taken into serious consideration from the people who are raising these issues, to make sure that Vision Zero's engagement with disability doesn't just turn out to be completely performative. And so, as you can see, some solutions that seem to advance Vision Zero may superficially involve trade-offs, but I'm hopeful that sustained and meaningful engagement with people with disabilities can resolve these trade-offs and yield more robust solutions. And therefore, this is not an excuse for cynicism to do nothing and to preserve the status quo. I'm happy to take questions. My email address is my first initial and my last name. That is PVENKATARAM at ucdavis.edu. Thank you. I'll turn it over to the next speaker, or at least for now, back to Steve.
Thank you so much. I happen to be a huge proponent of the raised crosswalks, so I think you raised a really good one for all the professionals listening. So with that, I guess we'll virtually roll up the Pacific Coast and turn it over to Anna.
All right. Hi, everyone. It's great to be here today with you all virtually. And if you're in New York in person at the conference, I will be co-leading a walk roll audit tomorrow morning in the Bronx. So I'll be on a red eye shortly and looking forward to seeing some of you in person. I'm going to go ahead and share some slides as well to talk about my work. So hang on while I get that started. Right. Wonderful. So my name's Anna Zivarts, and I direct the Disability Mobility Initiative, which is a program at Disability Rights Washington in Washington State. And I grew up here in Washington State. I'm low vision. I don't drive. I grew up in a place without sidewalks, without transit, and I felt really isolated. And I dreamed of a day when I could live somewhere with better transportation access for people who couldn't drive. And eventually I ended up in New York City. I was there for almost 15 years. I love New York. I miss it terribly. I'm back in the Pacific Northwest now. That's where my family is. I have a kid. It's a great place to have family support. But coming back to the Northwest, I started to work for Disability Rights Washington and started to connect to other people like me who couldn't drive because of our disabilities, and started to recognize that I wasn't alone, even though that's what I felt so profoundly growing up here, that there are many, many adults who can't and don't drive. And that in bringing these voices together, along with folks who are too young to drive, folks who are too old to drive, aging out of driving, there really is a lot of us, and we can start to demand transportation systems that and land use and zoning and all of that work better for those of us to get around who don't have that access, and also for us to be able to move towards a society that relies less on car dependency. So just a few stats I want to share here quickly. And this is a shocking number, I think, to people outside of New York City, where there's sort of an assumption that many people don't have private vehicles or can't drive. But in the rest of the country, the assumption is if you're an adult, you can drive, and that's just not true. Statistics show that a third of people throughout the United States don't have driver's licenses. 31 out of every 100 residents in the U.S. don't have a driver's license. A driver's license isn't a perfect, fit to who has access to a car. We know many people have licenses but can't necessarily afford to drive. We also know that there's people who drive without licenses too. So we pushed for some more detailed studies here in Washington State. We just had a study conducted, funded by our legislature and conducted by Tool Design, that found that 30% of the population are non-drivers. Wisconsin did a similar analysis and found that 31% of their state population are non-drivers. And then there's other measures too that get into some of the transportation insecurity that people can feel. Even if they can drive, can they afford to drive? Do they have access to a car? The Transportation Security Index is a really great measure of that. And they found that in a national study, 1 out of 4 people in the US are transportation insecure. So just thinking for a second, who in your social circles do you know who can't drive or can't afford to drive? Whether that's younger people in your household or older people. If you're in New York City, it may be a lot of people. Even if you're in a rural area, there's probably people in your community, in your social circle, who don't have that driving access. And this is an image here of one of the folks that I organize with here in Washington State, named Jaime Torres, who's a non-driver who lives in a somewhat rural community, small town in the Tri-Cities area, and is frustrated about the lack of sidewalk and sidewalk maintenance. So Jaime is just one of many folks who I work with here in Washington State at Disability Rights Washington. And oh my gosh, my screen just went out. Well, it's back. All right. And so those stories, we organize folks who are non-drivers as part of our work here at Disability Rights Washington, the Disability Mobility Initiative. Those stories are mapped. The sort of visual manifestation of that organizing is our story map project that to date includes 275 stories of people who can't drive, can't afford to drive from every legislative district in our state. And those are very helpful when we're meeting with legislators to point out that if they think that everyone in their community drives, we can point them to stories from people who don't, who need different transportation options. And that has proved to be a very useful political tool for asking for more sidewalk funding, asking for more transit funding, pushing for safety changes like banning right turns on red statewide, which hasn't happened yet, but it's something we're pushing for. There's also, we have some of these stories on YouTube, and then we compiled them into a white paper with policy recommendations. So those are all available to check out and recreate in your state or your community. Just want to touch on a few of the themes that we talk about in our white paper and that we have heard from the folks that we organize. The first is that land use really matters. And this is an image of Seattle. This is right at where I-90 meets Rainier, which is a north-south main thoroughfare. It used to be a state highway. And there's all these like, it's sort of a clover leaf. There's all these on and off ramps that are slip lanes, unsignalized. And we're actually building a light rail station right in the middle of this freeway interchange. And so it's a real challenge for people to access what is currently the bus stops and what will be a major light rail connection, because you are being sort of having to dodge cars coming on and off these on ramps, and thinking about, how can we make a system, even if we're putting down these great transit connections, if we're not thinking about how people get to that transit, it's not going to work. It's not going to be accessible. There's an image also on this slide of Micah Lusignan, who is a non-driver. He's low vision, and he was trying to cross one of these. And it was really tricky because there wasn't great sight lines for the cars, so they couldn't see him trying to cross and he couldn't see them. And we have so many places like this in our communities that are really not set up for those of us who are walking and rolling. Another big takeaway from our work is how important housing affordability is. In the Seattle area and in many parts of our state, housing has just exploded in cost. And that means that people who are on fixed income, on disability, are underemployed or unemployed, have to move further and further away from where there is reliable transit, where there are sidewalks. And this is an image of Chris, who's down in the Vancouver area that's right north of Portland, and housing prices there have gone up. And so she's moved out to an area where she has to walk along this muddy path to get to the bus stop, and she's blind, so she's using a white cane in the mud to get to her bus stop. I also want to touch on another theme that we hear, and that is that on-demand rides really aren't the solution. And especially as we keep on hearing promises about robo-taxis or autonomous vehicles. What we see currently with Lyft and Uber is those aren't solutions that work for most people with disabilities. One big part of that is the cost. They're expensive, and they're increasingly expensive. There's also the fact that they're not wheelchair accessible. So for folks who are in chairs, that's just not going to work. And then finally, they don't exist. These services don't exist in more rural areas. You cannot call an Uber or Lyft in most parts of our state. And so we really need to make sure that we have reliable public transit and accessible sidewalks, so that it is possible to get around and not have to spend a whole paycheck or money that people don't have to hire a Lyft or Uber. So that's my last slide, and I look forward to taking questions from you all. I'll share my contact information in the chat. Thank you.
Thank you so very much. Now we'll go to New York for Eman.
Hi, everybody. My name is Eman Rimawi-Doster. I am in Harlem, New York currently. For those of you who may not know me, I am a disability justice advocate, and I've been part of the advocacy group, different advocacy groups for the last 26 years, working on equity and inclusion for a number of disenfranchised communities. And I've been focusing a lot more of my energy for the past decade and some change on disabled folks in access and accessibility across the board. So when we think about accessibility, it's not just, oh, we need it to be wheelchair accessible, or, oh, we need transportation to be accessible. Accessibility means a number of different things, including cost accessibility, because the poverty levels in disabled communities are staggering and the highest out of any disenfranchised community. It's also making sure things are accessible for more than just physical disabilities. I myself am a double amputee. I have lupus as well. So I need things that are physically accessible. So elevators and ramps and first floor entrances. But there are folks who are deaf, folks who are blind, folks who have cognitive disabilities and mental health disabilities, and their accessibility needs are different from mine, but are still under, ADA compliance law. So it's important to make sure that everything is accessible for everyone. I also love what the doctor mentioned about hiring disability consultants and hiring folks with disabilities in your organizations. And I would go a step further, saying, yes, hire folks with disabilities, but also don't hire folks with the same kind of disabilities. And I'm just saying it because I've seen it across the country, unfortunately. You think you have one person with a disability and suddenly they can handle all the things with all disabilities. And I think that's not incredibly equitable for folks with disabilities to say, oh, I'm going to be the end all be all. And so anytime I'm part of any group, any coalition, anything, I'm like, okay, yes, I can speak to physical disability. But if you really want to get an authentic depiction of what it's like for people dealing with these things, here are a list of people that you can reach out to. Folks who are deaf and blind, cognitive, mental health, all of it. Here you go. And luckily, people have actually reached out to these folks, which is great. And so that's doing a number of different things. That's making sure that you have authentic depictions of what people are going through in their lives. You're getting people paid, whatever the work is, whatever disability consulting. And you're also getting people out there so that folks know, hey, Eman's part of this. We can reach out to her for anything across the board, because I work on accessibility things all over the place, but I'm not the only one. So that's, I think that is incredibly important. And just like Anna said, like there are a number of different kinds of accessibilities. Folks who know me at Transportation Alternatives know that I was the deemed the accessibility queen for Access-a-Ride and accessible transportation. And we're still working towards that. But that doesn't mean that just because we've got for-hire vehicles that are doing things around accessibility, that the work is done. The work is never done, unfortunately. Well, fortunately and unfortunately, because I'll always have something to do, but it's lifelong, and it takes all of us to work together to make sure that everything is fully accessible. And also I want to say, I go to a lot of these meetings with like elected officials and all these big executive directors and all these big corporate people. And oftentimes the community members are left out. And so every single time I go to these meetings, I'm like, hey, you guys, why don't we invite some folks from my hood in Jamaica, Queens? Why don't we invite some people from the South Bronx? Why don't we invite some people from deep in Queens who are living in transit deserts to these meetings? And so make sure that you're doing this in the most equitable way, because we are not an island. I mean, okay, Manhattan is an island, okay. But theoretically, we are not an island. We are a community together, and we have various communities. And so I try to bring as many people together as I can so that we can build as much unity and community together and work on things that benefit us all, because accessibility is for everyone. You guys were talking about the curb cuts. It's incredibly important, whether it's a low sidewalk or a curb cut, those work for everybody. And making things more accessible and more accommodating for everybody works for everybody. And so if you make it more accessible, I always look at the cause and effect. Cause. You make things more accessible in a number of different ways. Effect. folks with disabilities can actually function in society. We can have jobs. We can go to school. We can go hang out with our friends at a bar. We can go hang out at in a community garden because it's accessible. And that's the thing. And I am very much a proponent of disabled folks living as independently as we can, because it's possible. And it's only possible if you have the tools put in place to make sure that you can live accessibly and that you can live independently. And unfortunately, some people don't see it that way, and they're just like, oh, we're just going to lock you guys all up in a nursing home. Yeah, good luck with that. But more importantly, make sure that we can live independently. And so that means across the board, accessibility everywhere, from transportation to schools, to hospitals, to storefronts, to everything. And yes, there are inaccessible hospitals and schools in New York City. I could send y'all some things. So the point is, make sure everything's accessible. Make sure you're hiring folks with disabilities. Make sure you're not hiring folks with disabilities who just, fit into a box. I've never fit into a box, and I don't plan on ever fitting into a box. And if you think outside of that box and think creatively and think innovatively, then you can come up with way more creative solutions to help the rest of the community. Because it's not about me and it's not about you, it's about we together. So thank you so much. I appreciate this, and I look forward to hearing more stuff. And I'll put my email in the chat. Thank you.
Thank you so much. I'm going to be blowing up your phone now to talk to you now that we're on the same page, my friend. So, no, just to sum up a couple observations, again, I think most people have signed up for this paper. Perhaps I'm preaching to the choir and you're already with us, but the CDC has identified 1 in 4 people have a disability. The UN has identified way more than 1 billion people with disabilities on Earth, and a lot of people work in cities that are trying to attract visitors, whether they're recruiting for a great job center or just to spend money coming to the opera or the park or what have you. But that is not an outlier by any stretch. Sometimes I get planners or engineers or architects pushing back, like, can't we just build a flying wheelchair or one that climbs up steps? And the answer is no. Those cost a half a fortune, and they might work 6 hours a day. So now you've got to be a billionaire to plug in 3 of those to cover, and they still don't roll you to bed. They still don't roll into a shower. So, this thing of fixing a person is very, very wrong. And if any of don't want to preach to, but if anyone on here has that feeling like, oh, I'll just wait for the magic bullet to fix spinal cord injury or what have you, or restore blindness, bad idea. We would not fix sexism or genderism by making everyone one gender. So let's not plan in that direction. And one other thought that came on from all the great panelists was just this whole thing of being able to cross the street safely. And obviously, as my colleagues have said, that relates to everyone. I had a person here that was very skeptical about I had this width of sidewalks that I wanted or the connectivity. Then they had twins, and it's like, oh wow, I'm rolling something. I don't identify as a disability, but wow, I was crashing into street signs, or I couldn't get across the mud puddle, Steve. Now I get it. And one last thing is, sometimes they were very busy roadways, and I guess this makes me think of the Pac Northwest example, but I'm not so sure the elevator crosswalks, or the elevated walk bridges are the way, because at least in Miami-Dade, 2 of our metro systems are not at grade, and the elevators are broken perpetually. I know when I visit Manhattan, I always go look for the elevator, and I think it's maybe 1 in 20, or I'm sorry, maybe 20% of stations actually have an elevator, but doesn't mean 1 out of 5 places you can get to, because there's days where it seems like 1 out of 3 elevators is completely broken with a construction fence in front of it, or maybe it's messed up with something nasty that you don't want to roll through and step in. So I feel like this bringing all of us to the ground level is much more inclusive and a much more simple approach. So with that, we're going to move into a few of the sent in Q&As, but I also just want to toss something out, and please have each panelist just go ahead and click on in any order. But we've all talked about how important it is to not just say this or pray this or watch a webinar, but we're happy to have a webinar, but go to colleges, go to the recruiting day and find people that are interested in planning and engineering that are with disabilities. Almost every university has a disabled student services or something like that. Go to them, get your flyers, because When I go to a firm that has 100 engineers, architects, and planners, and there's not one person with a visible disability, I scratch my head. This seems wrong. You know, sub consultants are great, but transitioning to that, since not everyone's going to go on a hiring spree instantly, I've come up with the idea of requests for proposals need something that says universal design / inclusion. Some proposals have ADA coordinator or ADA barrier-free removal. In Dade County, once again, that's just these giant architecture firms. Somebody does a half-an-hour seminar, gets pre-qualified. They look at it for a half an hour. Restrooms get built, fouled up. Those outdoor limited use, limited access lifts, I'm sure I'm going to get sued by the company that does those some days, but they're key operated. The key disappears 2 weeks into it. If it lasts more than 6 weeks, the screw that operates it breaks down. They may well be in your building code in all 50 states, but they're like building a paper roof on a building. It might look good at the groundbreaking or the ribbon cutting, but it's not going to serve human beings. And pretty much we all design, whether it's horizontally or vertically, we design for human beings. So with that note, I'd like to hear my panelists think about, whether the RFP is a device or a device to take this from the talking it to walking and rolling it to really doing this. So give me some inclusion ideas.
Yeah, I've worked with a lot of different architects around New York City, and I always start with saying, like, you guys, let's be intentional about it. Because if I'm not even a thought, then you're never going to consider what my needs are, and I'm not considered as a patron or a customer or a visitor. And so first and foremost, be intentional about it. Look in the room, just like you said, you've seen a lot of conferences in a lot of places that don't have one person with a disability on the panel. So look in the room and see who's missing. Because I always do that, and I'm like, oh, okay. And I point it out because I think that people aren't even thinking about it. And if you don't know that you don't even know, then you have no idea. And so I think it's it's good and bad, but I think it's incumbent on us as, being connected to disability justice and disability rights to say, hey, you guys, that's not okay. I know you're not doing it on purpose because you don't even know that you don't even know. Let me educate you on this, this, and this. And so let's be intentional and be supportive. Like it's not in my nature to like point fingers and blame. I'm all about education. And sometimes education is about pointing out things that people don't even realize because, like you said, with your friend with the twins, they didn't even know. They didn't even consider it until they were dealing with it. And so if you bring that to people's attention and they're like, oh, snap, I didn't mean to do that, my bad. Then at least we can start from scratch with each other and say, okay, well, now that you know, there's no excuse. Now, if you tell them and then they still don't do it, that's different. But if they didn't even know, then, it's our job, I think, to educate them so that they can get to a better place. So, thank you.
I'd like to concur with concur with everything that Eman just said, and add to that also that, like, I completely agree with the idea of reaching out to people with disabilities and making sure that a diverse group of people with disabilities in terms of disability itself is represented in whatever projects that you're doing or what have you. And that's certainly something that I have strived to do myself because I have a physical disability as well, but I realize that I am not, an expert on all things disability, and I've had to learn a lot in the process. At the same time, I do think it might be helpful to maybe make a couple of concrete, no pun intended, suggestions in terms of what kinds of things people, who maybe architects or planners or what have you should be aware of or looking for as a starting point, certainly not as an ending point. So things like if your design has some sort of a grand staircase with either no elevator, although that, hopefully shouldn't be happening under the ADA, but maybe, on elevator that's, tucked away in some corner that's hard to get to. What are you saying about people with physical disabilities, which may in many cases include people who are elderly and have acquired disabilities over the course of aging and other health issues that may come up? If you're designing things that, are sort of monochrome or very low contrast, what are you saying about people who have vision impairments? If you're designing things that end up like especially big open spaces within buildings that end up echoing a lot, what are you saying about people who have hearing impairments or other hearing disabilities? If you're designing spaces that don't have sort of adequate refuges for people to take a little bit of time for themselves, for their own care, in whatever way that may, in whatever form that may be, what are you saying to those people? You know, this could include people with disabilities, people who are nursing babies, what have you. So, you know, those are the kinds of specific things that you might want to consider looking for. And there are so many others that you'd be able to learn about by actually meaningfully engaging with a variety of people with disabilities in your work. Anna, you're on mute.
Yeah,
Anna,
I was
would you
trying
like
to
to
get
join
myself
me?
off mute and respond to some of the questions in the Q&A around statistics. So I am going to paste some answers into the Q&A. I know there's a lot of questions about that 30% number. So I will put some links in there and some explanations. So check out the Q&A for that. I would just add one more piece on the, you know, including folks with disabilities. And, you know, one thing that I think is interesting to talk about and that we see when we're surveying people who can't drive or can't afford to drive is that there are many folks who have disabilities that do prevent them from driving, but they do not identify as disabled. You know, I myself, it took me until my mid-30s to be public about my low vision, and, you know, open about it with employers, with people I met. There's a lot of shame and stigma. And so for people who have the choice of masking, which is not everyone for sure, but many people just don't like to use that label, don't feel comfortable with it. And so just being aware when you're thinking about this work that there may be, you know, very like reasons, whether they're physical or psychological, that someone can't drive, but they may not choose to label themselves as disabled. So one piece there. The other thing I wanted to touch on was the importance of bringing folks into your advocacy work, but also if you work for an agency, transportation planning agency, transit agency, you know, any government agency, the importance of hiring people with disabilities in your agency to do this work. And that may look different than what you think traditional employment needs to look like. Perhaps, you know, there's a different number of hours that someone needs to work a week or can work a week. You know, obviously there's going to be accommodations people need, but I would really encourage people to think outside of who they think an employee should be or what they should look like, because there are so many people with disabilities who are underemployed and unemployed who care deeply about making our communities more accessible and would love the opportunity to be more involved and be, you know, paid for that work. And I can't tell you all how important it's been to find people who work at agencies or get people placed in these jobs and have someone on the inside who really gets it and understands the importance of what we're fighting for. And so if you're in a role to make a hiring decision, to write a job description, to rethink your HR system, and take out unnecessary ableist requirements like driver's licenses or the ability to lift 50 pounds, we see those a lot. Please do that, because it will increase you know, the folks who think they can work with you and really expand your ability to serve the community better.
Thank you so much. That is just so spot on about job flexibility. My goodness, you know, let's face it, within a disability community, there's someone who is brilliant and could be doing fabulous things for your city, township, or county, and they may be a volunteer librarian because they read the thing and it's, oh my God, I can't lift that weight, or I need to work a straight 8 to 5 p.m. 5 days a week, or you shoot me, or what have you. You know, and just a couple other old saws to share with the group, which again, perhaps preaching from the pulpit to the choir, but you know, the ADA is wonderful. Please, everyone out there, remember, it's civil rights legislation. It manifests in building codes in the built environment, but sometimes I have city managers, the town architect, the county planner come to me and say, oh, but Steve, this is low cost housing, which is actually needs to be 100% affordable, accessible. But can we get a waiver? Oh, this is some old building and it's just an architect and they're going to convert it to a dentist. And I'm thinking that's medical care. You should want to, and can't we get a waiver? And trust me, folks, if you don't already know that, that's like getting a wait saying like, hey, I want to in leap year fire everyone of color, or I would like to never hire a female again. Can I get a waiver for that? It's every bit as egregious, offensive, and quite candidly disgusting as that. So please educate all of your staff that we don't hand out waivers for human beings, for humanity and civil rights. And that said, the ADA is great, but a lot of people think, oh no, there's the lawyers, or oh, here's these very difficult calculations. So what I always tell people is, the ADA is the floor. When you have a client, or if you are a city or a transit agency, if you're doing the bare minimum, that would be like if your child suffered a compound fracture at a playground and you rushed in the emergency room and they said, here's 2 Tylenol. And you're like, hey, you're like, nope, you needed medicine. I got you medicine. It's a checkmark ADA is a very disingenuous thing. And when people say, oh, hey, consultant, please let us do minimum, no mayor stands in front and says, oh, this is the minimum swimming pool. We made the crappiest pool you could make, or this is the minimal office building where we hope no one occupies it and there's no job creation in our town. So when you aim for just bare bones compliance, that's sort of what you're doing. You're saying, here's an entire class of people who could be doing brilliant things and earning so much money they never consider a nursing home or subsidized housing or door-to-door paratransit. And just this thing, don't sell short. I hope no one would go up and say, oh, you're in this class and we're just going to throw crumbs at you because we don't really think you're in the main circle with us. So that said, I also want to make it clear, I think all my colleagues have, that I've yet to find anything, whether it's curb ramp, accessible, you name it, a raising boarding platform for an at-grade trolley. I've never seen anybody balloon up to 700 pounds because it was accessible. I know there was this big thing of healthy design and you hide the elevator and promote the stairs, or make an obstacle course because people walk it off. No Olympian ever ballooned up. And I actually have a little experience in that because I turned 59 this Sunday. 3.5 years ago, I weighed 320 pounds. I am only 5'10", so I was about as wide as I was tall. I started doing more hands-on with workshops and looking for universal design and accessibility, and wonder that I'm 180 pounds, and my doc said my numbers are a 40-year-old. So again, I know we're talking to the choir, and we've got well more than 100 participants, but this isn't some touchy-feely fad. Making alternatives for transportation, making an inclusive built environment, it helped me, and I am, by definition, non-disabled. So with that said.
Yeah, and I just want to also chime in too, because it's like, I really appreciate that you brought up the ADA, because I've constantly brought it up at press conferences throughout the years. And the way I bring it up is like, you guys, we're not asking you for a favor. I'm not here to have a feel-good conversation about equity and inclusion. I'm asking you to follow the law. Because if I have to follow the law as a citizen, then you have to follow the law as an agency who's providing a service that we're paying for. And that means including services for folks with disabilities that aren't wildly expensive, that don't take hours and hours to get during a day, like with Access-a-Ride and paratransit, or that you have to wait until 2050 to have more train stations be accessible. We're at 23% currently from the last numbers I saw. And so when they announced that, I was just like, you know what? I'll tell my boss I'll be at the office by 2050. Because it's just that's what you're telling me, that my professional life and everything that I have to do isn't important enough for you to do this accessibility work. And that's not just me. That's the nearly 1 to 2 million other disabled folks living in the city as well. So it really, again, be intentional about it. I know you guys aren't trying to be, not nice people. I was about to say a cuss word. I know y'all not trying to not be nice. I know you want to be accommodating and you want to have things be equitable, but truly be intentional about it and make sure everything's accessible for everyone. There we go. My coffee just kicked in. So
yeah. There you go. Yeah. And we love you for that. No,
I do want to just add to what Eman just said about the intentionality of it, and sort of building on this idea that I mentioned in my slides about like, if I can do it, you can too. One of the excuses I've heard in New York City about the reason for why elevators have been so slow to come to subway stations is the age of the system and the density of the areas that surround, especially the most heavily used subway lines. I don't really buy either excuse because Boston and Chicago have equally old, literally equally old systems in equally dense areas, and they have been able to do it.
You are correct, sir. I want to bring up something that may not be in a specific Q&A submitted, but I still do reporting on non-disability town planning issues. In one of my recent articles, there was a fellow by the name of Jason Barr. I hope I'm not scrambling his name, that's in the New York area. And he's, among other things, he's an economist that looks at climate change. And, he says, well, there's these cities saying, like, and here I am in Miami, where we're at ground zero. I'm on the highest point in Miami, and I'm not 24 feet above sea level. So, New Orleans and we are going to, disappear if we don't do something. But the point being, he says, you in Miami have like a $10 billion, and that's just the start price tag. And a lot of your politicians saying, we can't afford to do it. And he says, you can't afford not to, because you're going to be gone. And before you're gone, every business is going to leave, and your toilets won't flush because those work on gravity. So you're dead, even if, unless you're going to stand on your porch shooting wild boar or something, you're gone as a civilization. So that I want to turn that into a disability analogy, because I know a lot of people are, well, we're hardliners, or we're in this party that we feel like we're only going to help land a business. Well, guess what? Nursing homes cost what, $400, $450 a day? And you pay for that for a lot of people. Wouldn't you rather, subsidize housing, which we can't build enough, and ends up costing the square footage of a luxury housing, which we do still need to build it because there's a huge gap. But wouldn't it be wonderful if we had a complete built environment that didn't have subsidies? We talk about the paratransit rides. In Miami, it's $7 per round trip. So even if you just go to work and grocery, you're $14. At the end of the month, you're paying for what, a rocket jetpack, or being carried around on a papal Popemobile litter. So, and when you think of all these people that have master's and bachelor's degrees that are working from home or afraid of losing their supplemental Social Security, all these folks. So I kind of feel like that's a red and a blue issue. We're not the bleeding heart, poor me, poor guy across from me. This is, every economic development director. How do we create more jobs in our city? How do we move people around? This is how you do it. And the bonus spinoff is it's safe for kids to walk to school. So maybe every other mom and dad's not dropping them off and losing an hour of productivity queued up and burning up the environment, with 50 cars waiting to pick up 50 first graders. It's just this, the investment pays off. I don't have a Harvard Business School ROI, return on investment study, but I guarantee you, if you make connectivity and make your built environment inclusive, it's going to pay for itself. It's not this mythological lost leader that some bean counters say.
Yes, I so agree with that. And that was the cause and effect that I was talking about. You make everything accessible, you make everything work, then everyone has access to things, and you can get to work, to school, to friends and bars and all the things, and do all the things. And I think that that's something that folks don't honestly think about, specifically with disability. Oftentimes, every time I leave my house, someone's got something to say to me because I've got metal legs and a walker, and I'm not going to hide my disability. And they're not used to seeing someone like me out and about, even though I'm like, you guys, there are millions of us here in the city. You're just not paying attention. So, but that, more importantly, it's because society as a whole wants to put us in a box and put us away, like the ugly laws, so being like, oh, we don't want to acknowledge your disability. We don't even want your disability in here. So we're going to lock you away in an institution or a nursing home and throw away the key and forget you ever existed. And I'm so grateful, even though I think the ADA is a little too broad and should be more specific and should be much more inclusive, that makes it so that someone like me doesn't just get locked up and have the key thrown away. And so I think that it's incredibly important, again, to be intentional, but more importantly, to recognize that there are so many folks with so many different kinds of disabilities, both apparent and not apparent, who are in your stratosphere who may not even feel comfortable talking to you about it because they know how society reacts and responds, and they might have seen you or heard you say something, and they're like, oh, you're not the person that can talk to about this. So let's be better allies to each other and not be performative allies, be actual real allies who show up for people in a non-judgmental way and in an inclusive way so that we all can be a community together.
Perfect example. And then, I want to say preach it, but no, but one other thing I just want to bring up to folks is, because I know in the planning industry and the transportation, they're sort of like that flavor of the month, or here's our new panacea, or here's our new thing. And most of them have validity, but I want to remind folks of one. I'm not going to throw all the dockless scooters into the bay or into the river, but when you say, aha, we've solved our first last mile, aha, you have not, because if you don't write super strict rules for corralling those and fine those companies if those things show up where they shouldn't be, and maybe in a big city like New York or Miami, have a 24-hour person running around in a truck or whatever from Lime or Bird Bike or whatever, picking up those things. That's their whole job, to scout, because otherwise they show up in curb ramps, they show up in crosswalks, they show up at transit stops, and they are murder. And it's not just tripping visually impaired people. Some people with cognitive issues, it's a distraction. Certainly with a wheelchair user, if you have minused a beautiful 5-foot wide sidewalk into 30 inches or less, you have blocked the chair. So again, it's not the panacea. Not to mention, there are some bicycles that are for some people with disabilities, but certainly if you're a quadriplegic, that doesn't answer. So I don't like these, aha, we brought these companies in, and my goodness, they did it for free, and they're going to give us 1% of revenue. We've solved everything. And again, I know this was mentioned earlier with our friends in rideshare, with Uber, Lyft, et cetera, but we had a downtown development authority here that they defunded an extra layer of a circulator bus that was accessible and then returned that or replaced that with vouchers for the rideshare. Again, power wheelchair user, they basically just said, we're reenacting those infamous ugly laws where, you disgust us. Why don't we just warehouse you somewhere? Or if you can, lick envelopes behind closed doors, we'll live with that. But please don't walk among us because you are flawed. So, don't do that. And the other thing to remember, when I go back to how we always get this flavor of the month or tagline of the year, aging in place. I think if we all Google right now, town planning, aging in place might come up in a third of the stories. Well, and I know our people at ARP, it used to be, hey, save Social Security and Medicare, and that's it. And now every other article is about, hey, 10,000 baby boomers retiring each day. I think it's 2030 or earlier, more people in the U.S. over 65 than under 18. So when we talk about comfort and welcoming and inclusion, it's not just to get a person with artificial legs or an assistive mobility device to work and back or to park and back. It's to make seniors still active. I want a very brilliant senior to volunteer at the library, to teach me a second language, to not sit at home and rot. We all learned during COVID when we were sheltering that mental health issue. We all benefit from that random occurrence and running into people that are different than us. The more inclusive you build your environment, you're gonna bump into people, and we learn from that. And I don't think that's idealistic at all. I think that's proven. I don't know who else, if we don't have a ton of time, but if any else wants to think of anything. I know one of our questions, I think when we sort of did our baby rehearsal that I'll throw out to the group was, people listen to this and you have jobs, and I've seen some of the folks that have signed up are disability coordinators and seem to be really plugged in, but maybe if you're not, when you go back and the bosses just say, oh, just do this business as usual, just do conventional, and we'll add this on at the 11th hour, or we'll fix it if we get sued. I'm curious, just we've touched on every element, but from my panel, just some more ideas for the brilliant people that signed up for our thing when they go back to, hey, folks, this is not an outlier. It is front and center. Don't just do business as usual and then tack on the fix at the end, because that pretty much screws up anything from cooking dinner to, so thoughts on that, please.
Yeah, I would suggest that people, I always tell folks, if you're not aware of anyone with a disability in your office, considering there are so many folks with disabilities, especially in New York City, that I think it is incumbent on those organizations, whatever they may be, to have disability, equity, and inclusion trainings for their staff. Because I think some people don't even, like, I've talked to some organizations that are like, what are you talking about? We have about, our staff is like 90% Black women. And I'm like, have you ever heard of lateral discrimination, you guys? Like, clearly you haven't. So that's something that you need to actually talk about and break down, because there are issues across the board. No matter if you think that you have the most inclusive and liberated staff, even the most inclusive and liberated staff, it has issues. So make sure they get the training for it. And then once you have the training, then again, be intentional about your search for folks with disabilities who you may want to work with, because there are a number of folks with disabilities that I know who don't even work in accessibility, who do all kinds of other things. And so looking at someone with a disability being like, oh, you're just on accessibility. No, that's such limited thinking, completely limited thinking. And I think that if you look at us as whole people, you can see us as whole people. And so that's the part of being intentional. So I would say training and intentionally looking for folks.
And you fired up my brain. The entire, planning, mobility, transit, everything that's here today, I think it's a field that's very ripe for mid-career professionals to change. I do think you should be going to colleges and college fairs specifically, reminding, let's face it, you have one person on your staff that puts out pipes for measurements or crawls down a manhole. Everyone else disabled can do it. It's insane to think that they cannot. So, I would be, some of the best planners and some of the best transit execs I know started out as an attorney or something totally different. One I knew was a taxi driver, and I don't mean just through school. That's what he did till 38 and then got the spark. But, we always talk about planning being, some architects are starchitects and they build monuments themselves that we can't relate. This is on the ground. We all, everybody can understand crossing a crosswalk safely or getting to more stores into accessibly. So I think it's just incredibly ripe for having your HR people, having your recruitment find mid-career professionals. Maybe there's a frustrated stockbroker that has a disability that could just 2 weeks into it, they're solving your problems that you would need to consult 19 training programs. I don't think that's too idealistic to view it that way. So if my clock's correct, they're just about going to grab the vaudeville hook and pull us off the stage. So anybody, Anna, Prashanth, anybody, any other thoughts before they blip us off? Okay, so I thank everyone in attendance. I think we've all committed to trying to answer questions offline and try to, certainly, most of us consult, so we do love dialogue back and forth and perhaps an opportunity to help you bridge some gaps. So again, I have such a great panel. I'm going to be bothering all of you more now with my questions.
Please do. Please bother me. Everyone bother me.
I know.
Likewise, I put my email address in the chat, and so before the chat closes, please do copy and feel free to reach out.
No, this is just, I'm so pleased that we had more than 100 people at peak, and then those 100 are gonna go back and tell 10 of their colleagues about, hey, this isn't some stand on your head outlier. There's no magic. This is just an extension of the straightforward things we're doing. But the stuff we're doing is going to be doggone wrong and lacking if we don't include this element. So, and again, disability is the only marginalized group that you can join in a split second. So it behooves all of us to take an interest and care. Not to mention, I grew up with a completely homogenous hillbilly area. When I moved to the big city and met people differently than me, life got a heck of a lot more interesting. When you go to the tavern or coffee shop and every story isn't the exact same thing you lived. So, I just think there's myriad benefits in this. It's not some lost leader or feel good or check the box or we get in trouble. So I believe we may be done here. So I will thank everybody and give the thumbs up.
Bye. Thank you, everyone.